report. Let's just show you some statistics before we bring in our special guest to talk about the situation. This shows you the number of cancers that could be prevented. 4 out of 10, perhaps. It is said the 7.1 million new cancer cases worldwide linked to preventable causes, and the burden of preventable cancer is higher for men, 45% versus 30% in women. Let's show you some more statistics before we go to our guest. Tobacco, leading preventable cause of cancer, 50% of all new cases. Infections responsible for 10% of preventable cancers. And alcohol consumption, responsible for 3% of preventable cancers. Well, there you go. Things perhaps that we can do. The WHO is saying 30% of cancers are preventable. Let's bring in Hanna Fink. Hanna is doctor in epidemiology and researcher at the IARC, which is the International Agency for Research on Cancer. Hanna, thank you for being with us. We're really looking forward to hearing what you've got to say about the situation. And can I just say something really openly now? Because cancer affects everybody. My sister has lung cancer. She's in a bad way, and we know what's going to happen. Sadly, there's obviously a sort of very little we can do, but we're hoping to enjoy every possible day we can. And it affects everybody, every family, all across the world, so many people. So everybody watching this is hoping you're going to come up with something positive. So Hanna, please tell us, what can we do? What can you find? What is happening? Is there any way this disease is going to be beaten?
Yes, thank you so much for having me. It's a pleasure to be here. And I'm so sorry to hear about your sister.
Thank you.
I hope that you can enjoy these months with her. So we found in our study that almost 4 in 10 cancers are potentially preventable. And that amounts to about 7 million lives. So that's 7 million lives that actually don't need to be changed by this devastating diagnosis. And we looked at 30 things that we can change, which we call modifiable risk factors. And they include everyday behaviors like tobacco smoking, alcohol consumption, having a high body weight, and not doing enough physical activity. And what's new here is that we also looked at 9 infections which can cause cancer, like the human papillomavirus, which is linked with cervical cancer, and hepatitis B and C virus, which is linked with liver cancers. And globally, the 3 biggest contributors, which you mentioned, are tobacco smoking, infections, and alcohol. But what's really stand out in this study is that we need kind of a 2-tier prevention strategy. So of course, there's things that you as an individual can do to reduce your risk of developing cancer. And at the International Agency for Research on Cancer, we have the European Code Against Cancer, which gives you steps that you can take to reduce your risk, such as not smoking, reducing alcohol intake, maintaining a healthy body weight. But we also need health system changes, which promote healthier environments for people and for people to make these healthier choices.
So once upon a time, people didn't know that smoking was bad for them. I'm thinking of the time when, say, my father was a young boy and he started smoking at a ridiculously early age, and lo and behold, he had a very shortened life because of lung cancer. Nowadays, we know that smoking is bad for us, yet still some people do it, and that's their choice, their personal choice. There are people who will make the choice to do these things in spite of the evidence that you're putting in front of them right now. What are these changes that you're talking about in the health system that can help? Can you give us more on that?
Yeah, for sure. It's a great question. I think that number one, there are some risk factors that people are not aware of, like alcohol consumption. A lot of people aren't aware that actually that's a risk factor that can lead to cancer. And I think the first step then would be to raise awareness, so people have the knowledge to make informed choices about their health, which you don't have the full picture right now. But we also need things like alcohol regulations. With tobacco smoking, they've implemented advertising advertising bans. So the same thing maybe could be done for alcohol, just creating healthier environments for people to make safer choices and informed choices.
Hannah, I live in France. Wine, of course, is part of the culture. Does that mean the glass of wine with a meal is something one should avoid?
So previous studies have found that there is actually no safe level of alcohol consumption when it comes to cancer. But I mean, everyone is human, we're not saying like cut it out cold turkey, but already reducing the intake would decrease your risk.
So if you can reduce what you're taking, you're saying there are certain limits that people say, sort of, I don't know, sort of 1 pint of beer per month or whatever it is, which seems very Spartan to me, I must admit personally. Is that something people should be aiming for? You're not saying people should cut out things completely that they enjoy, but they should look to reduce.
Yes, that's completely right. Like reducing already goes a long way.
Okay, in terms of exercise, that's something people need to take on board as well?
Yes, exactly. And I mean, small changes can already go a long way, getting a few more steps in every day, doing just 10 minutes. It doesn't have to be huge. Just a little can already go a long way.
Do you think, Hannah, one day we'll be having a conversation about how cancer's been beaten?
Um, to be honest, this research does give me a lot of hope. I mean, 4 in 10 cancer cases potentially preventable. That's not a small number. But of course, there are still risk factors, that we might not be aware of. And cancer is a complex disease. It might not just be the one thing that's leading to cancer. There are still other things at play. So, we might not totally beat it, but we can reduce the burden significantly by targeting these risk factors
Dr.
that
Hanna
we know
Fink,
of.
Dr. Hanna Fink, thank you very much indeed for giving us your wisdom and your thoughts on the situation and some pointers that we can all take on board to try to reduce our risk. And of course, we hope anybody who's suffering with cancer right now, maybe watching this, maybe take some heart in the fact that there are things that can be done to ease the way forward. And thank you for your best wishes regarding the situation regarding my sister. Thank you. Hanna Fink, Doctor in Epidemiology at the IARC, the International Agency for Research on Cancer. Thank you for joining us.